Okay, let's start our today's topic. So last time we were discussing about various birth control methods, right? We have discussed some temporary methods of birth control. The various temporary methods of birth control they include this rhythm period method, or that is also known as safe period method. That also includes this coitus interruptus. That included chemical means. That included mechanical method, physiological method. We have discussed all of them, right? Now, today we are going to discuss some other methods of birth control. Another method of birth control is known as abstinence. Abstinence. So, abstinence means totally avoiding sex. Totally avoiding sex. Or abstaining oneself from sexual activity. Although this is 100% reliable method. When there is no sex, there is no apprehension of getting pregnant. But this method is impracticable. Because married couples feel very much uncomfortable in this method. They cannot avoid sex, right? So this is a 100% reliable method, but it is not practicable. It is impracticable. It cannot be practiced. Then there is another method, although that is not completely a birth control method, but that also leads to birth control. That is known as MTP. MTP, medical termination of pregnancy. So first we will discuss what is MTP. What is medical termination of pregnancy? So we will first define it. MTP, or medical termination of pregnancy, is the termination of it is the termination of an undesired pregnancy. Termination of an undesired pregnancy by the help of a registered registered medical practitioner. Medical practitioner before the fetus becomes viable. Before the fetus becomes viable, right? So, termination of an undesired pregnancy, a pregnancy which is not liked by the parents, right, or which is not required by the parents, by the help of a registered medical practitioner. So, this abortion, it must be carried out by a registered medical practitioner, by a gynecologist. When before the fetus becomes viable, before the fetus becomes capable of self survival, right? According to of MTP Act of 1971, MTP, medical termination of pregnancy, it could be carried up to 20 weeks of gestation. According to MTP Act of 1971, medical termination of pregnancy could be carried up to 20 weeks. But this MTP Act, it was revised. MTP Act was revised in 2017. And according to this revised 2017 Act, now MTP can be carried up to 24 weeks of gestation. So after conception, MTP can be carried up to a time of 20 weeks. According to MTP Act of 1971, the Act was then modified. Now the new Act, MTP Act of 2017, according to this Act, MTP can be carried up to 24 weeks. That means up to the gestation period of 6 months. A pregnant lady may get his pregnancy terminated according to the MTP Act of 2017 up to 6 months of the gestational age, right? So this is the definition of MTP. It is the termination of an undesired pregnancy by the help of a registered medical practitioner before the fetus becomes viable. So when an abortion is carried out on medical grounds, when an abortion is carried out on some medical grounds, then it is only known as MTP. So which abortion can be called as MTP? Let's have a look. MTP is guided by some medical laws. So which abortion is considered as MTP? Let's have a look at that. An abortion which is carried out to save, an abortion which is carried out to save the life of a pregnant lady is known as MTP. Is known as MTP. So an abortion which is carried out for the purpose of saving the life of a pregnant lady. If a lady is pregnant, but this pregnancy is having some dangers associated with it, this pregnancy may pose threat to the life of the pregnant lady. So if she wishes, she can get rid of that pregnancy by the help of a registered medical practitioner. So that abortion, which is carried out to save the life of pregnant lady, will be known as MTP. Similarly, an abortion which is carried out to get rid of, an abortion which is carried out to get rid of a fetus having some serious genetic disorder or some serious metabolic disorder which may be associated with significant morbidity, may be associated with some significant morbidity. So a lady who is pregnant and by this amniocentesis or by ultrasonography, she comes to know that her fetus is having some serious genetic disorder, because of which the baby after birth cannot live an independent life, or the baby or the fetus is suffering from some serious metabolic disorder, and after birth the baby will not be able to live an independent life. Or if the baby is born, but that baby will always be having some significant morbidity, the baby will be suffering from a serious disease. In that case, if the couple wishes, they can go for abortion, and that abortion will also be called as MTP, medical termination of pregnancy, right? So if a pregnancy is associated with some serious genetic disorders, some serious metabolic disorders, or some serious diseases, due to which the baby after birth cannot live an independent life. If that fetus is got rid of, right, then that abortion will be known as MTP, medical termination of pregnancy. An abortion which is carried out to preserve physical or mental health of pregnant lady is also known as MTP. There is a great risk associated with multiple pregnancies. If a lady becomes pregnant year after year, right? If a lady is continuously having issues year after year, then that leads to health deterioration. And If a pregnancy is terminated on the basis of preserving physical health of the mother or the mental health of the mother, that pregnancy will be also known as MTP, medical termination of pregnancy. Similarly, there are some other points which make an abortion an MTP. Do you hear me? Yes, sir. Okay. An abortion which is carried out to get rid of a pregnancy which is the result of rape or contraceptive failure or contraceptive failure will also be known as MTP. If a woman is raped and she gets pregnant, or if a woman was using contraceptive device, unknowingly the contraceptive device failed, now she got pregnant. So whether it is a case of rape or it is a case of contraceptive failure, and a pregnancy had occurred, that pregnancy can be terminated if the couple wishes. So this pregnancy, which is a result of rape or contraceptive failure, it can be terminated. This abortion can be carried out, and this abortion will be also known as MTP, the medical termination of pregnancy, right? So an abortion which is carried out for any one of these points, any one of these reasons, will be known as MTP, right? If a lady is pregnant, she has a normal fetus in her womb. She comes to know that this fetus is a female. She doesn't want to give birth to this female fetus. If she wants to get rid of that fetus, that abortion will be termed as illegal abortion, right? If a woman has done some illegal activity and she got pregnant, now she wants to get rid of that pregnancy. So if she goes for abortion, that abortion will be termed as illegal abortion, right? If a female has normal fetus and she doesn't have any one of these causes for the abortion, so that abortion will also be termed as legal abortion. So an abortion in India is legalized only for these reasons, right? An abortion in India is legalized only for these reasons. So an abortion which is carried out for these reasons is only termed as MTP, medical termination of pregnancy, right? Now, how this abortion is carried out? What is the method of carrying out this abortion? The safest period for MTP is first trimester of the pregnancy. Safest period for MTP. Safest period for MTP is first trimester. It is first trimester. That means the first 3 weeks. First 3 weeks of the gestation, they are the safest period for abortion or MTP, medical termination of pregnancy. However, it can be carried out according to MTP Act of 2017. A doctor may carry out MTP up to 24 weeks, but this is associated with some risk. Right? A fetus becomes viable at the age of 6 months. 24 weeks means 6 months, right? A fetus becomes viable at the gestational age of 23 or 24 weeks. So a fetus can live outside the mother's womb from the age of 23 weeks to 24 weeks, right? Earlier, the abortion was carried out only up to 3 weeks. Then MTP Act of 71, it provided doctors the liberty of carrying out this MTP up to 20 weeks. Then MTP Act of 2017, now it gives doctors the permission to carry out the pregnancy after 24 weeks of gestation, right? Now, how this abortion is carried out? Method. Method of abortion. This abortion, it is carried out by three methods. One is known as DNC. Another is known as vacuum aspiration. Vacuum aspiration. And another method for carrying out abortion is intravaginal intravaginal use of prostaglandins. Prostaglandins. So the first method to carry out abortion is known as DNC. DNC means dilation and curettage. So this DNC, it involves the dilation of the cervix. It involves the dilation of cervix. When the cervix is fully dilated, then by the help of a lab apparatus known as a curette is a long spoon-like steel apparatus. It is a long spoon-like steel apparatus. By the help of this curette, then they scrape off the embryo from the uterine wall. So that is why it is known as DNC. DNC, dilation and curettage. So in this method, first the cervix is dilated. When the cervix is fully dilated, then the implanted embryo, blastocyst, it is scratched off from the uterine endometrium to remove the fetus, right? So it involves use of some oral abortifacient drugs. Oral abortifacient drugs. So in this method, a patient is first given some abortifacient drugs, those drugs which help in abortion. Those drugs which help in abortion, which cause an abortion, those drugs are known as abortifacient drugs. They are given orally to the patient. Which drugs are given? There is a drug known as mifepristone. It is given in combination with another drug that is known as misoprostol. So mifepristone in combination with misoprostol, it is given to the patient some 6 hours before carrying out DNC orally. This drug is given to the patient orally some 6 hours or 4 hours before carrying out dilation and curettage. So these drugs, they help in removing the blastocyst from the implant, from this uterine endometrium, right? They cause cervical dilation, they dilate the cervix, and then by the help of them and by the help of curette, this blastocyst can be easily scraped off from the uterine wall. So this method is known as dilation and curettage. Where from this curette is inserted? This curette, it is inserted after cervical dilation through vagina, through cervix, then into uterus, and through intravaginal use of this curette, this embryo is scraped from uterine endometrium. Then there is another method that is known as vacuum aspiration. In this vacuum aspiration, a vacuum cup is placed over the blastocyst. Sorry. A vacuum cup is placed over the blastocyst. This vacuum cup is inserted through vagina. It is used intravaginally. So vacuum cup is inserted through the vagina, it passes through the cervix, then it enters into the uterus. In the uterus, this vacuum cup, it is fitted over the blastocyst. Then the vacuum motor is operated. This vacuum motor, it sucks the blastocyst from the uterine endometrium. So it detaches the blastocyst from the uterine endometrium, right? So by the second action of this vacuum cup, the blastocyst is scraped, it is removed from the uterine endometrium. So this method is known as vacuum aspiration. This is also carried out intravaginally. Then there is intravaginal use of some prostaglandins. These prostaglandins, as you know, they are the chemicals which induce strong uterine contraction. So these prostaglandins, they are inserted into the uterus of the female through the vagina and cervix. When they reach into the uterus, these prostaglandins, they induce very strong contractions in the uterine wall. And because of those vigorous contractions, this blastocyst gets detached from the uterine endometrium. It falls off. Then it gets removed from the female reproductive system. So these are the methods of MTP. They can be only carried out by a registered medical practitioner or a gynecologist. They cannot be carried out. They should not be carried out by any unauthorized person, right? So that is the method of MTP. Now this MTP, it has raised a hue and cry in our society. First of all, the religious scholars, they raised hue and cry. They didn't agree that it is a genuine process. They say that it is an unethical process, right? So all the religious persons, they raised hue and cry against this authorization of MTP. In the shadow of this MTP, many normal fetuses, they are being aborted, right? So it has created some problems in the society, but nowadays it is legally allowed under certain conditions, right? There should be a genuine underlying medical cause for carrying out this abortion. So those abortions which are carried out for certain medical reasons, for certain medical causes, those abortions are known as MTP, medical termination of pregnancy, and they are carried out by a registered medical practitioner only, right? So that is all about MTP. What is an MTP? It is definition. What are the guidelines? Which abortion will be defined as an MTP? Then how this MTP is carried out, right? So that is all about MTP. So these were the temporary methods of birth control. They all are temporary methods of birth control. Now we are going to discuss some permanent methods of birth. Now permanent methods of birth control. There are three permanent methods of birth control. One is known as vasectomy, another is known as tubectomy, and another is known as tubal ligation. So as I told you earlier, these methods, they are considered as permanent methods. Once these methods are used, they are not likely to be reversed. Doctors do not agree for their reversal. Otherwise, their reversal is possible. But when doctors do not agree, so for that reason, we consider them as permanent methods of birth control, right? So first method is vasectomy. So what is vasectomy? It is the cutting off vas difference of males. So vasectomy means cutting off vas difference of the males. If you remember the structure of male reproductive system, from testes arise vas difference. Those vas difference then they ascend into abdomen. Then in the abdomen they pass over urinary bladder. Then they join with the, suppose this is the scrotum. In this scrotum there is a testes. From this testes arises a vas difference. It passes over the urinary bladder. This is the urinary bladder. if you remember. Here it joins with the seminal vesicle. Then it becomes ejaculatory duct. Then it joins with the duct of the urinary. Then it passes through the prostate gland, etc., etc. If you remember, right? So, what is vasectomy? It is the cutting of vas difference in the testes, in the sucratal sac. So, just in the upper region of sucratal sac, an incision is given. An incision is given. A cut is given. And these vas differences, they are cut and their free ends are tied. The vas differences, they are cut and then their free ends are tied with catgut, right? So when the vas differences are cut, when the vas differences are cut, what was the function of vas differences? They carried the spermatozoa into their function was to carry the spermatozoa. The function of vas difference was to carry the spermatozoa up to the ejaculatory duct, into the membranous urethra, then into the penis, right? So when we cut these vas differences, now a male produces sperms. Male will produce sperms, but those sperms will not reach into the penis. Those sperms will not reach into the penis, and male cannot deposit them into the vagina of it, right? So in vasectomy, the vas differences are cut. Their free ends, they are tied by the help of a catgut or a surgical thread. They are tied. After then they are inserted back into sucratal sac. Then the male produces sperms. The male is producing sperms. But those sperms do not reach into the remaining part of the male reproductive system. They do not reach into the secondary sex organs of the male reproductive system. So male cannot ejaculate these sperms. When the male cannot ejaculate sperm, there is no chance of fertilizing an ovum. There is no chance of making a female pregnant, right? What happens to these sperms? These sperms which are produced by the testes, they remain in the epididymis where they are stored for some time, then they degenerate and they get reabsorbed, right? So in vasectomy, the vas differences of the males, they are cut, they are tied, then they are put back into sucratal sac with their tied free ends, right? So the male produces the sperms, but male is not able to ejaculate sperm. Male is not able to inseminate the female, right? So these sperms which are produced by the testes, they degenerate and they are reabsorbed, right? So this method of birth control, this is known as vasectomy, and it is a permanent method of birth control, right? Similarly, in females, we use tubectomy. So what is tubectomy? In females, we use tubectomy. So this is the uterus of the female. On the two sides of the uterus, there are ovaries, right? Then there is a fallopian tube. There are fallopian tubes, right? So tubectomy, it involves the cutting of fallopian tubes. The fallopian tubes are cut and their free ends are joined. They are tied by a surgical thread or a catgut. So in tubectomy, the fallopian tubes, they are cut and tied. Their free ends are then tied by the help of a surgical thread or a catgut, right? So what happens? The female produces the ovum. The female releases the ovum. The ovum goes into infundibulum. From infundibulum, the ovum travels towards the ampulla. But from ampulla onwards, the ovum is not able to. Or the male deposits the sperms in the vagina of the female. The sperms, they swim through the female reproductive system. But this sperm is not able to reach to the ovum, right? The sperms are not able to reach to the ovum. So this blocks the meeting of sperm with the ovum, right? So this cutting of the fallopian tube, to stop the ovum from coming into the uterus, or to stop the ovum, or to stop the sperm from making contact with the ovum. This is known as tubectomy. This is again a permanent method. Once the method is used, then it is not likely to be reversed. So this cutting of fallopian tubes to avoid the contact of sperm and ovum, to avoid implantation of the ovum, to avoid fertilization of the ovum, this is known as tubectomy, right? And it is carried out in females. Then there is another method that is known as tubal ligation. Tubal ligation. In tubal ligation, the fallopian tubes are not cut. Fallopian tubes are not cut. The fallopian tubes, without cutting, they are blocked. Fallopian tubes are blocked without cutting by tying a surgical thread over them. A knot is tied over the fallopian tubes. In tubal ligation, the fallopian tubes are not cut. Fallopian tubes are not cut, but they are tied. Their lumen is blocked by tying catgut over them. Their lumen is blocked by tying a catgut over them, or by tying a surgical thread over them, so that sperm cannot reach to the ovum. So that sperm cannot reach to the ovum, or ovum cannot go into the uterus. So this blocking of fallopian tube to prevent the ovum from reaching into the uterus, or to prevent the sperm from making contact with the ovum, this is known as tubal ligation, right? This tubal ligation, it is another important method of birth control.